Talking about cosmetic surgery today. One of the favorite cosmetic surgeons in the whole wide world, ladies and gentlemen, is Dr. James Stern is in the building.
James, what up, Doc? Dr. James.
How you doing, guys? It's great to be back with you, as always.
Good to have you on. I need to know this. The women who are calling about breast augmentation want to know what are the different ways to have the surgery done, number one, and what are the different kinds of implants?
There are four approaches that we use for augmentation. We can go through the armpit, called transaxillary augmentation. We can go under the breast, called the inframammary approach. We can go through the areola, the colored part around the nipple, and we can go through the belly button. Because of the popularity today of silicone gel implants, as opposed to the saline implants, we can't use gel through the belly button because it's an endoscopic or minimally invasive approach, and it can't fit through the tube.
Gotcha.
It can be put in through the armpit. It's a little bit more difficult, but the conventional approach for gel implants, which has taken a significant amount of the market in the United States, nearly 70%. Outside the United States, it's almost 100% gel augmentation.
Wow.
Is it true? I know you operate down in the Miami-Fort Lauderdale area. You all can reach out to him on Baisden Live on Twitter and Facebook. We have his information up there. Is it true that women in Miami and L.A. go for larger size than women, let's say, in New York and Chicago?
Oh, it's certainly true, Michael. Its geography has a big influence, and so is culture. You know, different cultures and different geographic areas want bigger implants. Dallas, Miami, L.A., the average implant is 25 to 35% bigger than the average implant in Chicago and New York. Part of that is the amount of time during the year which the women can sort of display their implants.
Right.
They can show them off.
Exactly.
Oh,
Have you ever done one at a time? Like, if someone couldn't afford both at one time. Just
All of our implants are buy one, get one free.
So what are the risks? I mean, what do you tell women in terms of being good candidates for them? What do they need to know?
The success for breast augmentation surgery, just like most surgeries, is for the patient to have realistic expectations. For a very small-breasted woman to go to a large-breasted woman is going to be a very poor result. So the patient who has soft tissue coverage or some breast tissue to begin with is going to have a better result than somebody who has nothing.
Gotcha.
Right.
So that patient has to be realistic. She can get bigger, certainly, but she may not be able to get as big as her friend who starts out with a B or C cup.
Let me ask you this. Is there something you won't do? If a woman says, I want double D's, and you know it won't look right, as a man who cares about his art, is there just something you won't do?
Absolutely. There have been patients, and it's not infrequent, when somebody will come in and ask for something that we think is not in their best interest. And because we don't do a heck of a lot of advertising, my patients are my advertising, so I can't afford to put patients out in the community who don't represent a good cosmetic ideal.
All right, how can they reach out to you, Doc? Because I want them to see you if they're in the Miami-Fort Lauderdale area, if they want to fly in to see you.
Best place, you can look at our website, yourplasticsurgeons.com, or just give us a call, 954-987-8100. We'd be happy to send out any information on specific procedures or send them brochures or pamphlets, whatever they'd like.
Ladies and gentlemen, Dr. James Stern, you all can reach him if you're in the Miami-Fort Lauderdale area. All the details are posted right now on Baisden Live on Twitter and Baisden Live on Facebook.